Let me tell you a little bit about this upcoming show today. I'm going to define the difference between the hometown carrier and the national carriers today. You hear me use that phrase a lot. We're Main Street, not Wall Street. Well, I'm going to tell you why. I'm going to tell you why Blue Cross and Blue Shield of Kansas is the only carrier that services 103 counties. I'm going to tell you why Blue Cross and Blue Shield of Kansas is the only carrier that goes below 5 lives on small group. I'm going to tell you that and a lot more. And my guest is Misty Snodgrass, and she's going to explain it all.
And now, America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website americashealthcareadvocate.com, americashealthcareadvocate.com. You have a question or comment, send me an email. I'm happy to help you. We had a young man the other day who needed a wheelchair. He couldn't get it. We were able to step in and help them make that happen with the good folks over at United Healthcare. So we're happy to help anytime we can. Also, we are on 16 podcast platforms and our YouTube channel, 604,000 views, thanks to Mr. David Thiessen, my producer that handles all of our podcast and YouTube channels and also films all of these shows and puts them up there for all of you to see and watch and listen to. We thank all of you in the listening audience and our audience in general for pushing those numbers up because they are better than anything we've ever seen. So we're very happy with what's going on. Once again, the website is americashealthcareadvocate.com if you have questions. In studio with me, Misty Snodgrass. She is the Director of ACA, Obamacare, if you will, and Medicaid for Blue Cross and Blue Shield of Kansas, back for another show.
Yeah.
You liked it so much the first time you came back to do another one.
I thought it was a great show. Thank you so much for having me.
It was a great show, and we got a lot of response after that show.
Great.
Because I think we explained to people, information that they didn't know and didn't have, and that's the whole idea behind this.
Absolutely.
So today's show, you hear me use this phrase a lot, okay? When I work with Blue Cross of Kansas City, Blue Cross of Kansas, and Blue Cross of Nebraska. So I work with 3 different Blue Cross plans on the radio, in marketing, etc. And I use that term hometown carrier with all 3 of those plans. And there's a reason for that. One of the things that I learned in the last show I did with Misty was there's 103 counties in Kansas. You know how many carriers are in all 103 counties? How many, Misty?
Just one.
That's right. And who would that be?
That would be us.
That would be Blue Cross of Kansas. So when I say hometown carrier, that's because I'm talking about the carrier that's going to service you wherever you are, whether you're in Hayes, whether you're in Scott City, whether you're in Emporia, it doesn't matter. Blue Cross of Kansas is going to have a plan, whether it's an individual plan or a small group plan. And we're going to talk a lot about those today, or a group health insurance plan of some kind. They're going to have a plan in your area that they can offer you, unlike a lot of the national carriers who kind of pick and choose where they want to be. And then you have carriers that pull out of the marketplace like Aetna did this year. 1 million people on ACA lose their coverage as of December 31st. So the hometown carrier means they live here, they work here, they're in our community, and they cover the entire state. And that's, I was going through show notes this morning. I was looking at some of the things that you wrote, and I'm like, they're really dedicated to this. This is a big deal to you guys.
It's part of our mission. It's to the core of who we are. We want to serve as many Kansas as we can. That is our pure mission. And so we are, we work here, we play here, we spend our time, we grow our families here, and we want to help support the employers in our communities that are, trying to find their way in this world right now. And also any individual members that are trying to find healthcare coverage.
Yeah, and it's confusing.
Oh, yes. Yes.
As she says, oh, yes. Yeah, in this year, it's really confusing.
It is.
And so, when we tell you that if you want to call and talk to somebody, that's not calling to get a sales pitch. That's explain. When they call, and you have award-winning customer service and great people out there that do a great job. So talk a little bit about that, because if you just want to call up and talk to somebody about, well, what should I do? That to me is really important. So talk a little bit about that.
Yeah, absolutely. I mean, this health insurance is complex for even those of us that work in it. It's not even just people that are trying to figure out in their open enrollment period, whether it be for individual or their small group plans. And so it really is challenging. What does coinsurance mean? What do all these terms mean? How does it impact me? That's the bottom line, is how does it impact me? And so we have great teams throughout the entire state of Kansas that are just focused to answer those questions for you. You're not going to get some you have to push one to talk to two people, all of those things, or talk to a robot. You actually talk to real live people in Kansas that know your health system at Hayes Medical Center. They know, Wichita Via Christi. They know what those providers are in your communities to make sure that they're covered. And they'll stay on the phone call as long as they can. Their goal is not to get you off. Like a lot of places is like, what can I, answer right now and quickly get you off and move on to my next call. Their actual focus is first call resolution. So they will stay on the call with you as long as they need to answer your questions. And they're not pitching you, any sort of products. They're asking you, what is your concerns? Are you concerned about out-of-pocket costs? Are you concerned about prescription drug copays? And so they're happy to answer those questions and help walk through kind of the scenarios. They'll look and see if your medication's covered on your formulary. Is your doctor in network? And it is a real person that answers. And we love our customer service team. They are award-winning because they really are focused on doing the good work and very passionate about it as well.
Yeah. And so those are some things that are really, let's kind of dissect that a little bit. All right. You see a lot of commercials on television, especially this time of year on the Medicare side and the rest of it. And most of those are for call centers, national call centers. And I used to make a joke. In fact, I still do, especially in Kansas City, that when you call one of those numbers and you ask them about the hospital north of the river, and they ask you what river, you're not talking to somebody in your own community. Okay. So, when you call and you ask, well, tell me about Via Christi, and they go, well, what is Via Christi? You probably know they don't know the hospitals in Wichita, and Via Christi being the largest hospital system in Wichita.
Absolutely.
That's the point. Okay. Yes. When you're talking to people and the people that work for Blue Cross of Kansas work all over the state of Kansas. Mm-hmm. So when you're talking to people that work at Blue Cross of Kansas, they know every one of those communities. Oh, yeah. And they know the providers, they know what's available and all the rest of it. And you're talking to people that live and work in your community. Mm-hmm. And that's really the whole point of this thing, isn't it?
Absolutely. Well, and I think it's just not only is it that we, know those, we live in those communities, right? So we know where Hoxie, Kansas is, and, our kids are playing on the soccer fields and they may get injured and need to go to, the local health system there. And so we really are knowing our communities, we are embedded in our communities, and we give back to our communities. I think that's really important is we are, your tax dollars are staying here, your premium dollars are staying here. And so it's really important because it helps to reinvest in Kansas. It's just like every small business owner. My dad's a small business owner. And everybody wants to reinvest in their communities because they know it just helps everything. And so it helps to uplift it. So we're there, we're volunteering. You should see how many volunteer hours we do in our communities. We're working at local zoos in Topeka. We're putting backpacks together for kids for school. We're helping at trunk or treats all around the state. And so we really are wanting to give back every single day to our communities as well as serve them.
See, and again, when I talk about hometown care, you hear me use the phrase a lot of times, we're Main Street, not Wall Street. Well, that's because they're not for profit. Mm-hmm. They're not looking at what the next quarterly earnings report is going to say. What they're doing is they're talking to you about what's going on in your community. They're putting back in your community. They're creating an opportunity to connect with the community and support people that live and work in Kansas. They're the same people you go to church with, the same people you go to PTA meetings with. I mean, they are the same folks that are there every day to serve. And again, they live and work in your community. So that's the difference. So that was the first thing I wanted to talk about today was this. What is this whole idea of hometown carrier? Why does it make a difference? When I come back from the break, I'm going to talk about some of those charities and the communities that they're involved in and what they're doing here, and let you hear what they're doing. And then you might want to ask yourself, are any of the national carriers doing this? Good question. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. If you're looking for information and you want to talk to somebody at Blue Cross and Blue Shield, you can call them at 866-906-5253. That's 866-906-5253. Or go up on the website, bcbsks.com. That's the website. Go up. All these plans are up there. You can explore these. And then if you want to pick up the phone and call, they'll be happy to chat with you, walk you through and say, maybe this one's a better fit than this one is. Or let's look at your formulary for your prescription drugs. They'll do all that for you. We come back from the break. We're going to continue the show with Misty. I want to talk about what they're actually doing in some of the communities. Where are they actually involved? And what's happening in the communities that Blue Cross and Blue Shield of Kansas is supporting right here in the state of Kansas. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Stay right there. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. Shout out to our affiliate up in Salina, Kansas, KSAL News Radio 1150. Happy to have us as part of the family up there, broadcasting to all the folks in and around Salina, Kansas. In studio with me today, Misty Snodgrass from Blue Cross and Blue Shield of Kansas. We're talking about the theme of hometown carrier. What does it mean to be that hometown carrier? Why is that different than the national carriers? And we're talking about what they do. We're also going to talk about the plans that they offer, where they service them. You know, this is the only carrier that services all 103 counties in the state of Kansas. That's a big deal if you're out in Hayes or Scott City, Emporia, where maybe the national carriers don't participate. So we're exploring all of that. If you want information on any of their plans, bcbsks.com is the website, or you can call their customer service folks. They're happy to talk with you. Just explore options about what you've got or what maybe you think you might want to change to. Once again, 866-906-5253. A lot of turmoil in the ACA Obamacare market right now. Open enrollment is here on November 1st, obviously. Now's the time to call and do a consultation. This is not a hard sale or anything like that. You heard Misty describe it. They're there to help you. 866-906-5253. All right, so let's talk a little bit about community involvement, because this is something you do that national carriers just don't do. Okay, they're not equipped to handle it, frankly, across the country. So, you know, to you folks, that's important. So talk a little bit about some of that, what you do, and how does all that work, Misty?
Yeah, I think it's really, really important because, like I said, we're not only investing in healthcare, but we're also investing in other initiatives that are important in our community. So one great example, we actually have a Blue Health Initiatives team that's dedicated to this. So we have an entire team of folks that are dedicated to working in community, helping support community-based organizations, local nonprofits. Where can we plug in and not, take over, but be a supplement to be able to assist them? Sometimes it's financially, sometimes it's just time and energy, sometimes it's volunteer work. And so that work is really important to us. It's the core of who we are. It is fundamentally important to our board. They actually report all of the information activity to our board of directors. That's how important this is. A strategic initiative for our company. It's a high priority. And so some of the things that we're doing in community is we're building local fitness courts in areas where there may not be a local gym or a YMCA. They're able to go to a park. It's an outdoor facility, and they're able to go lift weights. They're able to play on tennis courts. It's just to help encourage fitness and community, and also to create community.
Well, and in some of these communities, they don't have a gym in a rural community. They've got a community park. If you can go in there and add to that and make that, workout stations or walking stations, whatever it is, it doesn't sound like, okay, yeah, you know what, it's really important to people who live in that community.
Absolutely. And it's focused on wellness, overall physical wellness. We know physical health and mental wellness are key and tied together. And some of the other things that we're doing is, like I mentioned, we do some backpack events around back to school. We're stuffing backpacks with, school supplies. We're doing trunk or treats with, candy and so forth. And we're really focused on being in community. We support other initiatives. One great example in Wichita is called Baby Talk. And it's to help pregnant moms that need resources, while they're pregnant. They may not have information. I've been a pregnant mom before, and it's really nerve-wracking. And so we support that initiative in Wichita to help moms throughout the state. So it's virtually and in person in Wichita. It also provides, if people go through the classes and, kind of learn some, tricks of the trade, you also get a gift card for child carrier, car seat carrier, or you could get a crib. It's a gift card that could go towards those kind of purchases. And so it's really important that we invest in various initiatives that we're doing in local communities. And I could go on and on. I could spend days because I'm so proud of the work that our Blue Health Initiatives team is and how intentional they are. They're very, very focused. One other thing we're working on is how can we make our language access better? So individuals that may not have English as their is their first language.
Speaking Spanish.
Yes, absolutely.
Okay.
Absolutely. And so we're working to make sure that our materials, that they know their rights, because whenever you go into a healthcare provider, you have rights to have access to language access. So we're working on that right now to improve language access. And we know that that's important because, if it's not your first language, we think health insurance is confusing.
Yeah, well, I'll tell you a story. I was in Scott City, Kansas doing radio probably 10 years ago. And I'm like, what are all these feedlots out here? Well, the biggest slaughterhouses in Kansas, JPL and the rest of them, are just outside of there over toward Dodge.
Yep.
There were more Mexican restaurants in that town and I love to eat Mexican. I was like, this is like amazing. And I'm like, well, why are there so many Mexican restaurants? Because our entire population here, the working population, is 80% Hispanic. So
absolutely,
you think in Kansas, Dorothy's going to click her heels and she and Toto are going to ride off. It's not quite like that.
Yeah.
We have a large community of people here that are not English-speaking community primarily, and that's a big difference. So you guys are moving to help those folks do what they do.
Absolutely. And we're partnering with organizations. And also one of the things that we are hoping to do next year is go into those communities and help explain what their benefits are. Because we know if people don't know what their benefits are, they don't use them. And so we want to make sure that they're aware that we have telehealth available in Spanish, that we do have resources available in Spanish. And what does health insurance really mean? What does a co-insurance mean? That doesn't always translate, various languages. And it's very complex for, if it is our first language. And so we want to be really intentional and thoughtful to serve all Kansans, regardless of, what language they choose.
Before we go to break, I have to ask you, on the Baby Talk plan that you've got, those classes, you do not have to be a Blue Cross and Blue Shield policy. I want to make that point because Blue KC offers something similar to that on the behavioral side. So those classes are available for anybody in the state of Kansas, any mom that wants to do those classes. Where do they go? Do they go on your website for this?
We're going to have it on our website. We don't, but I will get you the website and you can put it up and share that out with your listeners, because it is a really important program to help educate, on prenatal. It's really important to make sure you're going to your doctor's visits, make sure kit count, all of those important things. And when it comes to prenatal and pregnancy.
I've got 6 grandchildren. Trust me, I know what my daughters went through. So I can assure you, this is a welcome thing to have in the community. And there are a lot of women out there that will be able to participate in this. So as soon as we get this information, we'll put it in the broadcast. We'll put it up on the podcast and on the YouTube so you all can see it. Anywhere in the state of Kansas enrolled, they don't cost anything. It's what they're doing to help folks in Kansas do what they need to do. If you want help, if you want the policy explained, if you want to understand what your benefits are, if you're looking for a policy and you don't know what to do, especially during this turmoil with ACA, 866-906-5253, 866-906-5253, or bcbsks.com, bcbsks.com. If you want to just go up and explore what are open and then call them, do that. They'll be happy to chat with you and make it work for you. We'll be right back after break. When we come back from the break, I'm going to get into some plans now. I'm going to start talking about what are they offering on the small group side. It's interesting, and we'll get into this in a minute. How many carriers offer plans to small group below 5? That's the question we're going to answer when we come back from the break. Stay tuned. I'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA here on the HIA Radio Network. So the website for Baby Talk is babytalkict.com. That's babytalkict.com. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producers today, Mr. Dave Thiessen behind the cameras, posting all these shows up on our podcast and YouTube platform. 604,000 views. Thanks to all of you. It's kind of amazing. And Garner Cowdery, he's on the board here working all the audio here at Cumulus at our hometown flagship station here in Overland Park, Kansas. In studio with me, Misty Snodgrass, once again here to talk about Blue Cross and Blue Shield of Kansas. We're talking about how unique they are to this state and what they do in this state that's very different than the national carriers. If you want help, call them. Just have a discussion. ACA is upon us, open enrollment. There are a lot of premium increases, people pulling out of the market like Aetna did, that kind of thing. 866-906-5253, 866-906-5253. No high pressure sales tactics. This isn't some number on television that you're going to call some national call center, okay? That's not how this works. These are folks right here in our community that live and work in Kansas. The website, bcbsks.com, bcbsks.com.
So when I'm going through these show notes this morning, I see this down to one life. And I remember when I was a broker, the major carriers, the national carriers, would not go below 5 lives. So there are more small businesses out there that are 1, 2, 3, 4, and 5 employees than you can shake a stick at.
Absolutely.
And they won't even offer them coverage.
No.
Well, so why is that, first of all?
Well, I think it's a lot of work, right? You know, it is a lot of work.
It's as much work to enroll 5 as it is 50.
100%.
Yeah.
And so I think that, you know, we're not focused on margins. So that's the difference. And we are focused on really helping all Kansans be covered. And so we believe small business, regardless of size, are the backbone of our economy and the backbone of Kansas. And so whether you're a small employer, a family-owned business, or a company with 50 employees, we have plans that are designed for you. And, you know, we believe every job matters. And we believe if you have, you know, 1 employee, 2 employees to 500, you're just as important, and we'll treat you. And we have teams dedicated for those size. So it's not just like you're going to, you know, we're going to give you preference to the ones that are 500 and plus.
You've got a whole segment of your customer service people and your sales reps that represent just 10 and below. That's it. So they understand that space intimately.
They do. And the complex needs around it, right? Like, you know, it's, you know, whenever an employer is deciding what health coverage to select, it's a really nerve-wracking thing. They're wanting to keep their employees for retention. They know how important it is. And, you know, every time, every employer, including us, you know, we went through our open enrollment. There's questions related to it. What does this mean for me? What does this out-of-pocket cost mean for me? And it's unique based upon the needs of every employer. And so it's a lot of work trying to figure out, you know, do you have, you know, individuals in your plan that are going to be high utilizers, folks that are going to have complex chronic conditions. And so we work through that, we listen, and then we try to reflect back and find the plan that actually works for them. So it's customized based upon and tailored, you know, our suggestions and you know, recommendations based upon the needs of you as an employer versus you calling a call center and they saying, here's our plans, here's what we have to offer here. And we actually will go out and meet with you. We'll go into your office.
5 lives. You'll go out and meet with you.
Yeah.
Less than that. Yeah, absolutely. And that is, you know, we love what we call them our micro groups. We love our micro groups. They are the heart of Blue Cross Blue Shield of Kansas because we also know those micro groups, sometimes they grow to be 100 employees, you know, and we were there for them when no one else was. And also sometimes they just want to be at 5 employees and 4 employees. And we are okay with that. We want them to grow and thrive in the way that's best for them and support them for their healthcare needs.
So when I'm going through the show notes this morning, I see down to 1 life, and it triggers in my mind a question I used to get, well, why would they offer a plan to 1 life? Well, the answer is you got a mom and pop shop, okay, and one of them is going to retire because they're turning 65.
Mm-hmm.
What happens to the other person?
Mm-hmm.
Well, they lose their coverage, right? No, they don't. Explain that.
Yeah, so they're able to stay on as a group. You know, there are certain qualifying criteria, but they're able to stay on as part of our groups. And, you know, they're not going to go get priced astronomically because they're in the metallic, you know, plans. And so they're able to go get that coverage for them if they want to be a part of a group, because sometimes that's more affordable than for them being in the individual market, or the plans may be more advantageous to them. And so, you know, we look at it as we want to cover every Kansan, and every small employer matters regardless of size.
So let's talk a little bit about EPO and PPO.
Yeah.
So this is how we kind of get in the weeds a little bit here. So these are 2 separate group plans. I think most people out there know what a PPO is.
Yeah.
That's the network, the largest network. But let's talk about the difference between that and the EPO. And there is a difference, and there is a cost saving.
Absolutely. And I think it's really important. And I know when I first started learning about EPOs, because they came on kind of out of, you know, like in, you know, right after the ACA passed was kind of where they started to rise to prominence. And, you know, an APO is called an exclusive provider organization, you know, and it's typically a lower premium, and it's a real simple network design. And so it's perfect for businesses that are centered primarily in Kansas, that they're not going to have a lot of people traveling or employees outside of the region, so in other states, because, you know, it is more affordable to not have, you know, a national-wide network. Now, that doesn't mean if you're traveling and you have an emergency, you're not going to be in network. You're not going to get some out of network costs. It's a lot of confusion around that. They think, oh, I can't leave the state. Oh my gosh, I'm in Oklahoma. I got to go drive back to Kansas and I have a medical emergency. No, we want you to go to the hospital.
It's covered just like anything else.
It is. We are, so we have that focus. And so it's really advantageous for kind of your local regional employers that are in the state. We also have a PPO design. And, as remote work kind of blew up during COVID and the pandemic, we have employees that are in multiple states, right? So there's employers that have people that are, on, close to the Kansas border that are actually living in Missouri. We have people that are on the southern border of our state that are living, Oklahoma, but they work in Kansas. And vice versa around all of our surrounding states. And so we have what's called a PPO so that they're able to leverage what's called our Blue Card network. So you basically are a host member on a different, region of the, so you'd be on, Blue Cross Blue Shield of Nebraska's network, but you're still a Blue Cross Blue Shield of Kansas member. And so it gets a little bit complicated, but you're able to access all the local providers in your community. And so you're able to leverage that nationwide network as part of your in-network.
So I want to go back to the EPO thing for you and just kind of drill home something here. So let's say you're in Wichita and you're listening to this and you think, you know what, I need to find out about that EPO. I'll bet you that 90% of your care would be at Via Christi Hospital or Via Christi Providers, because that's Wichita, okay? Mm-hmm. I used to do a lot of work in Wichita. We're on the radio down there on KNSS. I know it very, very well. Well, then how much of a need are you going to have to go outside of network? Well, if you're going to go to KU for cancer treatment or heart or whatever it is, that's in network. Mm-hmm. If you're going to go to Via Christi, that's in network. So, I mean, what was the name of the hospital in Hayes you mentioned?
Hayes Medical Center.
Hayes Medical Center.
They're in network.
Okay, that's in network. Yeah. So when I ask you to look at this EPO thing, and if you look at the value that's being offered, and the value is that you're in the whole Blue Cross of Kansas network in all 103 counties, mm-hmm. and you can save money, it would make a lot of sense to take a look at that and go to your employees and say, here's what we're going to do. We're going to cut costs by X because we're going to go on this new plan with this EPO. You've got all the hospitals in Kansas, but you're not going to go to MD Anderson, okay? I mean, there you go, okay? You're going to go to KU. Well, interesting enough, KU has a partnership with MD mm-hmm. Anderson. So you can get a lot of those treatments at KU that you can get at MD Anderson because they're already there. My point in telling you that is it's worth exploring.
Yeah, absolutely.
Okay, so that's why when she talks about that dedicated team of 10 and below, give them a call.
Yeah, we have over 90% of the providers in Kansas in network. So it's a broad network, even for an EPO. So it's fantastic, coverage. So if you're even traveling the state, you're able to access that, which is not like other EPOs out there.
It's not. And it's very, very different because they're offering coverage across the state and you're ready to go. And this is what I'm talking about when I say, pick up the phone and call one of their folks at that team that's dedicated. All they do is 10 and below. They know what it means to have a 3-life, 4-life, 6-life case. All right. And they're happy to talk with you and show you this is what the plan looks like. Here's what we can do. And all your people have access to all the hospitals and doctors throughout the state. They're inside that network. So do it. 866-906-5253. 866-906-5253. Their website. You can go look at the plans on the website, vcbsks.com, vcbsks.com. We come back to the break. We're going to talk about what's going to happen in the marketplace this year. How many national carriers are coming in here with aggressive new plans? How does that compare with what Blue Cross and Blue Shield of Kansas is doing? And how does that compare for what you're looking for? And what's the stability of that? We'll talk about all that when I come back from the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Don't go anywhere.
Welcome back. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. The show today is focused on Blue Cross and Blue Shield of Kansas, the hometown carrier. I did that on purpose because I really wanted to get you to understand the difference between what they do in this state where I live, where you all live, okay, and how that contrasts with what the national carriers do. We're going to dive a little more into that. But once again, we talked about that EPO, PPO. There are a lot of different plan designs out there that they can help you with. If you want information, 866 906-5253. You're not going to get high-pressure sales tactics. You're going to get somebody who wants to talk to you and explain their options. They've got a whole team of people on 10 and below, so employers with 10 or fewer lives. National carriers don't even go below 5 lives. They do. Blue Cross and Blue Shield of Kansas goes down to 1 life, okay? Also, the website, bcbsks.com, bcbsks.com.
All right, so let's talk about this, because this is what actually triggered me doing this show today, was you and I were having conversation after the last show, and I knew this was coming. I didn't know it was already here, that a certain national carriers are coming in here this year, and they do this from time to time. They'll come in with very aggressive pricing in the marketplace. And then 2 years later, when the claims numbers start going up and they're catching up with where they are, they pull out.
Yep.
Now, as an example of that was what happened with Aetna. They lost $2 billion on ACA, and they finally said, we've had enough. And they didn't just pull out of Kansas. They pulled out of every state that they were in. Okay, so it does happen.
So the point there is, you guys are always here.
Yes.
It's steady.
Okay, let's talk about that.
Yeah, I think it's a great comment. And, and Cary, if you remember this a few years back, this happened again, right? When things didn't get as profitable, when there was kind of the seas got a little bit, tumultuous, other carriers pulled out of the market, and it just kind of happens over and over again. If they're not hitting their margins, they have shareholders, we don't. And we have our members that we're focused on. And so I think that we're always here. We want to serve this market forever. It is a passion of ours. It's our CEO. It's probably one of his favorite markets, actually. If he said he had a favorite child, he'd probably say it was. I don't know that, I'm just kidding. But he really is passionate about serving small employers and individuals as well, and making sure they have access to care, because, a lot of folks will go after the big, the national carriers will go after the big employers, but a lot of them won't stick around for the smaller or the individuals. And so
they won't even offer coverage.
Absolutely. And so we want to be the stable carrier. We have been the stable carrier. We've never left. We've been around for 80 years. We've been here since the ACA began. We have no intention of leaving. We're actually, part of my role is to actually, what can we do to even enhance our ACA market? What can we do to actually serve our members and our employers more and better, and provide, help improve the total cost of care, but also, and on affordability, but also help. What other tools can we bring that are innovative to help, both impact the individual from a quality of life perspective? So we're having conversations about mindfulness tools for employers, because we know behavioral health is a major concern. And so what can we do to help improve and, reduce, employee, productivity, help improve that, missed days, because of whether it be physical or mental illness. And so it is a high priority. We're here to stay. And we're very passionate about the work and serving all 103 counties that we're in.
Yeah, and it's not a come and go situation. We're here this year and 2 years from now, and believe me, we've got multiple examples of this that happens. Okay, these folks at Blue Cross and Blue Shield of Kansas, there's no quarterly earnings report.
No,
it's a little different. When I say Main Street, not Wall Street, that's what I'm talking about. Okay, and that's what's important. And when you talk about your CEO actually focusing and acknowledging that, that's pretty significant.
Absolutely.
Because that means he understands, as you said, how many small businesses out there or, have 5 employees or 10 employees. Okay.
It's the cornerstone of our economy and our communities. Small businesses are donating to the local high school football teams, and it just trickles down. And so we understand how important, and it's a cornerstone, and we're here to stay.
So talk a little bit about some of the product lines that are going to be offered this year on the group side, both small group and the larger group side.
Yeah, absolutely. So we have small group, we have EPOs and PPOs available. We have various metal tiers. So I think I talked about that in our last program. We have in small group a platinum, gold, silver, and bronze. And we're the only one in market with a bronze plan. And I think there is going to be a new entrant on the platinum plan. But we have most of our small groups are in gold because they want to have a richer benefit, lower predictable out-of-pocket costs from deductibles and maximum out-of-pockets. And we also offer predictable co-pays. A lot of carriers will have co-insurance, and that's when it gets really messy, right? Like people are like, what is this going to cost me when I go to the pharmacy counter on this particular drug I'm on? And so co-insurance is, I always say it's kind of fuzzy math. It's very hard to predict We have a predictable copay. You know, if this is your medication, you're going to go pay this amount.
Tier 1, Tier 2,
Absolutely.
Tier 3, whatever
Yep.
it is. That's it. It's not that. So here's what she's saying. It's not that plus 20%. Well, you take Jardiance, okay, and my wife takes it. I've actually paid for it. It's $700. Okay. Now you got your copay. Let's say your copay is Tier 3 or Tier 4. It's $75 or $100. Oh, and you owe 20% of the total cost of that med. That's a little different deal.
Yes. And we do have caps on our high cost specialty
Sure.
drugs as well, because on what you have to pay out of pocket so that you'll know what you're paying. Because we do want people to take their medications. We know when people are on their medication.
Kind of helps, doesn't
They're
it?
staying out of the hospital, right? And the emergency rooms, which are higher cost of care alternatives. And so we do have a priority on prescription drugs, predictability, your copays for your doctor. We actually incentivize you to go to the doctor. So we have, you know, your first 5 visits are like, you know, basically in some of our plans free, or they may be a $35 copay depending on what metal tier you're on. And so we want folks to go to the doctor. We're not wanting you not to get care, because we know you're gonna stay with us for a while. Usually, most of our employers have stayed with us for 40 plus years, and so we want to make sure we're taking care of folks, because those national carriers, they'll come in and have aggressive pricing, and then 2 years they'll increase it, and then all of a sudden they're gone, and you're no longer it, and you'll come back to us usually, and then you know that we want to focus on making sure you're well, both physically and mentally.
We got about 45 seconds left. Talk very quickly about virtual, because all the rural counties have this is a big deal.
Absolutely. And we think it's a big deal. So we have telehealth for physical and mental health. So instead of going to, you know, you have an ear infection, you know it's an ear infection, right? You don't want to go sit in a waiting room, or I don't for sure, in an emergency department. You don't want to go pay for that copay. We provide, typically, some of our plans there is some variability, but usually free telehealth services. And so you're able to go in and access, you know, it's AML is our current vendor that we use, and you're able to go access that, 24/7, be able to go get your prescription. You don't have to go sit in a waiting room. And so you're able to have that. And so that helps, especially in areas when there aren't providers.
Yeah. Or you're in a rural community, you have to ride 45 minutes to get to an urgent care center or something. This is great. It's online. You go on, you're on the screen, you're talking to the doctor, nurse practitioner. You get what you need. It's one of the many things that they do. Thank you. This is a wealth of information. It's like drinking from a fire hose, but I'm telling you, I think a lot of you learned a lot today about what Blue Cross and Blue Shield of Kansas does. Now you know why I say the hometown carrier, because that's really what they are. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together, or they are surely going to perish together as fools. I don't think truer words were ever spoken. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, here on the HIA Radio Network. Goodbye, America.